we received a call to our emergency helpline 1066 stating an 82 years old lady having high-grade fever, shortness of breath, severe cough with altered sensorium since morning. Our emergency specialist team took all the details of the patient, the condition of the patient and their residential address, and immediately with the proper personal protective equipment, the ambulance was dispatched with the emergency physician and paramedic within a span of 3 minutes.
They immediately sent the ambulance. It was here very soon despite the roadblocks and despite the COVID crisis.
They checked the vitals at home and started immediately life-saving interventions at the residence and shifted to our ambulance. Crew informed back to emergency department about the condition of the patient and required interventions to be kept ready.
As soon as we went in, we were asked to wait outside because very limited people were allowed into the hospital. They took her in, and within about 10 minutes time, the doctor who was with us throughout the journey, who came to our house, he got back to us within 10 minutes time and updated us on her situation.
The crew in the triage team re-evaluated the patient and found to have features suggestive of suspected COVID and took the patient in isolated triaging area. They re-evaluated and found to have high carbon dioxide levels in her body. They informed the attenders about the requirement of artificial breathing machine, ventilator to be put, as her breathing was very difficult. As she was suspected to have a COVID symptoms, the COVID sample was taken and sent to the lab, and it will take minimum 2-3 hours for us to get the report. So all the required management was kept on doing in the emergency. Meanwhile, she had a very low blood pressure, so necessary medications were started and stabilized.
We were actually not allowed even into the emergency. We were waiting at the hospital and she was kept in the emergency until her COVID test came back. It was for the safety of the others, and we completely understood that it was the hospital protocol.
Within a span of 2 hours, her blood pressure improved, her oxygen level improved in her blood, and she was stable enough, and then we shifted her to the medical ICU for further management.
Within 3 days, she was in a position to be able to go back home, but we wanted her to stay for a day or two just to completely make sure, and the doctor, our doctor's pulmonologist, Dr. Sumant Mantri, also gave us the option. I really liked how Apollo was, the staff in the hospital, they were very friendly, which is something that I've always liked, because now they know her because she's gone so many times. They recognize her the minute they see her. They're very friendly. They take care of her. They cheer her up, which is something that I really appreciate. Thanks to Apollo, she's back. She's safe. She came COVID negative, which is, for someone who had all the symptoms and for, having suffered from asthma, really grateful.
The advantage of Apollo Advanced Cardiac Life Support ambulances, it's completely equipped like an ICU. It will be manned by emergency specialist and a paramedical team who is trained completely in handling the medical emergencies. The advantage is the treatment starts from the door of the patient. In fear of COVID pandemic, don't neglect any medical emergency which may lead to complications. With confidence, go to emergency department and get the best medical care.